again at 11.
Today with Claire Byrne on RTE Radio 1 with Opel. The all-new Opel Mokka. With a new visor front face and pure panel interior, this is Opel.
Okay, this is a trip from Cabra to the H-Branch.
Good morning and welcome to the programme today.
Enjoy.
The Delta variant causes
RTE Radio Home and Beyond.
plans for the digital COVID certificate.
And hopefully
will the government have to rethink the further reopening plans?
Camera stays in focus.
90,000 children on hospital waiting lists. Evelyn meets some of their families and their doctors. How to get cars out of our cities? Do we need congestion charges? Close contacts at
I've no idea what we're going to take.
Holohan tweeted last night that the strain now accounts for up to 20% of COVID-19 cases, with a number of outbreaks reported in the last week. Aoife McGlysett is Professor of Genetics at Trinity College Dublin and member of the Independent Scientific Advocacy Group, and joins me on the line. Good morning, Aoife.
Good morning.
Our listeners who heard the bulletin there at 10 o'clock might be concerned to hear what the Minister for Health had to say when he was joining the Cabinet meeting, talking about the level of severity when it comes to the Delta variant being higher. What can you tell us about this?
Well, I think the will be relatively preliminary because it's really only the UK that has been monitored, and it's only been unfolding there in the last month and a half or so. But the initial evidence was that they've got higher rates of hospitalisation with the new with the Delta there. So that is concerning in and of itself. I mean, the good news, of course, always remains that the vaccines are very effective once you have received your course of vaccination. And so that is the really positive news there. But this is something that does need to be taken very seriously. And as we are further behind in our vaccine rollout as compared to the UK. And what we see there is, they've been warning, Public Health England and independent bodies, they've been warning for a few weeks now, since mid-April. And those warnings were included, and now in England it's 99% of cases. And we are in a position where we can actually heed the warning. There's very little to disagree with what I heard in your news bulletin there, in terms of it is a concerning variant, more infectious. We want our vaccines, we need everybody to be double vaccinated. And even the comments on the toilet so that we don't want to panic. We don't want to panic. We should be acting now before it's a panic situation.
And what does acting now mean, Aoife, in your book?
Well, I think one thing that we really need to reconsider this indoor reopening is basically throwing oil onto the flames. And at the moment we are planned by government to reopening of indoor hospitality with really no standards of ventilation. Ventilation is basically key. The breathing in outdoors is so much safer is because it's safer. And if we're talking about opening indoor hospitality, where the staff are generally young, so they're not going to be vaccinated, not eligible for vaccination yet. And the clientele are also young. We're only allowing 37-year-olds register for their vaccine today, and it's going to be an indoor setting, no masks if you're eating and drinking, it's not possible. And if it's not well done safe, that's just going to be a disaster. And we have seen already how quickly things can get out of control and how long it takes to get things back under control.
Aoife, we're going to try and get you back on a better line because I'd like to continue to talk to you. It's just breaking up a little bit, but in the meantime, Dr. Mary Favier, Covert Advisor to the National College of General Practitioners, is with us. Good morning to you. Thank you very much for joining us, and I know you will have heard some at least of what Aoife has had to say. Do you think now is the time, we've hit this bump in the road, as the Taoiseach said is on his way into Cabinet today, to press pause, to reconsider where we are and perhaps not reopen for indoor dining and drinking on the 5th of July?
infectious. This is a much more transmissible variant, at least 50% more. And particularly it's affecting younger people more. It's affecting people with different symptoms, more headache, runny nose, sore throat. So the type of thing that younger people in particular might put down to a cold. So the real concern is if we move indoors, we have very congested environments, but we'll also have a lot of young people working in this hospitality industry, and it's really a recipe for problems. And if you look at what they did in the UK, they did pause. They did delay their wider opening because of the Delta variant, and so it is a concern.
This is very difficult for many people to hear. The people who are running the businesses, the people who may have planned to have their wedding slightly larger, as the rules would have permitted in July and August. But you're saying now is the time to relook at all of this.
Yeah, I think it's so hard for people. It's so hard for all of us. It's so hard even to be the naysayer. It's so hard to take caution, but we absolutely have been here before. We were here in December and early January, and there's a lot of harm still being unpicked through the system. The impact on people, the death, the hospitalizations, but the impact on non-COVID care. And GPs are still seeing very substantial numbers of patients who have not have presented for care because of COVID. We do not want a situation again where our hospitals are potentially overrun. And we know that you're more likely to be hospitalized with this variant. You're more likely to have serious illness with this variant. Now, the vaccines are effective, but they're not perfect. If you look at a 95% effectiveness rate of a vaccine, that's still 1 in 20 people will not be protected. And you can't know who that is. It could be you, it could be me. But if you think that it's about 80% effective against the variant, that's now actually 1 in 5 people is not protected.
Okay.
And to keep those safe, we have to keep the numbers really, really low in the community.
But we're not seeing, at this stage anyway, any increase. In fact, the decline is still on, isn't it, when it comes to hospitalisations, in particular people who are being treated in ICU?
Yeah, indeed, but our variant has gone from 5% 2 weeks ago to 20% of cases now. And Dr. Tony Holohan, as the CMO, I think quite appropriately has sounded a note of caution yesterday. Let's just really think this through. In 2 or 3 weeks, they make all the difference in terms of slowing down to really push on with vaccination, because vaccination is so effective. And we'd really ask people, it's the second dose of vaccination that makes the difference. And GPs are noticing that people are getting a first dose and then sometimes not turning up to the second, delaying the second. They're away for the weekend, they have a holiday booked at somebody's birthday party. We say, please get your second dose of vaccination, because it is the one that actually makes the difference.
Is there any way we could outpace this variant by stepping up the vaccination programme? And I know that very many people, tens of thousands of people, are being vaccinated every week, but could we outpace it, do you think, Dr. Xavier?
I think that would be with supply. The mass vaccine clinics are doing a great job. They are truly sending out any vaccine that's being delivered. GPs are continuing to vaccine, and 50% of GPs are continuing through the summer in their practices to roll it out to the younger age groups. But it's about supply, and supply is really restricting us. It's improving across the summer, but it's really to make sure we have a substantial number of people who don't turn up for appointments. It is so unfortunate when a vaccine appointment gets wasted, and we would really ask people not to do that. Book on the portal, get your appointment. Employers are being very open and helpful about facilitating people to attend appointments. We've asked them to continue to do that, and to really people turn down all other things you might need to do to get your vaccine.
I'm sure you remember a number of weeks ago, if not a couple of months ago, there was some talk of vaccinating younger people first, because they're the people, as you say, who are more likely to socialise, they're more likely to work in some of the bars and the restaurants. I mean, looking at things now, it would seem to have been a wise course of action to take. Is it possible, do you think, to revisit that? Because we're only inviting 37-year-olds now to register this week.
I think it's worthy of discussion. I think everything's on the table in terms of how to fight this. And there is merit to doing the 19 to 24s and reversing the order of the vaccine priority. But that's a hard decision, because we have had very significant social solidarity on a very clearly understood way of rolling out our vaccine protocol. It's by age, and age trumps everything. And that evidence is still correct. So it needs to be looked at whether that would be an appropriate thing to do. I think NIAC will, for instance, address that. But at the moment, we need to stay with what we're doing, and we need to go down by the ages and get the older people vaccinated first.
Okay, and Aoife McLeod is back with us now. On that point, Aoife, ramping up the vaccination programme, going beyond and more than 300,000 vaccinations a week, do you think it might be possible to outpace the variant?
I think with vaccinations alone, probably not, because as Mary there has just said there, we have a supply issue, and that's the limiting factor. But we can, we can outpace this in other ways, so we have vaccination, but we can also be sending more resources towards our public health units and getting those better resourced. Our contact tracers should be, when the numbers go down, we should be expanding who we're tracing, tracing contacts of contacts. And this is what they do in other countries when we can get really successful with containment. And that's what we really should be doing. We should be throwing every resource at this. We should not be relaxing at this point. The cases in hospitals and all of those other factors, there's a lag before we see the increase there. And it's clear that's what you see in the UK as well, where things looked like they were going down for a while or looked like they were steady for a while. It was actually underneath this curve there was the Delta variant coming up, and that's causing them problems now, and we should really be avoiding that.
We're going to be talking about travel with Minister Oisin Smith. He's involved in this digital COVID cert, getting it up and running for the middle of July, around the 18th of July. Is that something too that you would like to pause?
I think travel, you have to be very, very careful with travel. Like, this Delta variant came to Ireland through travel, it came to Europe through travel, and this is clearly what a very significant factor. So if we're talking about continuing as we are, which is allowing people to travel just because they have a PCR test that's negative, which is really, as we know, a point in time, that's not sufficient. If you want to have safe travel, you should have all travellers and all airport and airline staff should be vaccinated. That should be the metric for safe travel, because in an airplane you're sharing air. We know well documented cases of transmission that has occurred in transit, and we're just adding extra complication to an already difficult situation. So we can have a good summer, and the initial plans of the government until very recently was for an outdoor summer with a domestic holiday, and then they suddenly appeared to be talking about indoor hospitality and international travel, and they're really doing it at the wrong time when things are actually starting to look precarious. They're adding this extra level of complication, which really we saw what it did last summer. Last summer, it ruined it ruined the following months. It looked okay during the summer, but it's travel that brought new cases back in, and it looks like we're determined to repeat the same mistakes, and we really shouldn't.
I want to go to Donegal now and speak to GP and chairperson of the GP subcommittee of the Irish Medical Organisation, Dr. Dennis McCauley. Good morning, Dennis. Thank you for joining us today. People, I would imagine, just can't face this if it's going to be stop-start again, and any more delay in opening up would be dreadful news for many people. Would you agree?
I would, and I think we have to be honest about this. I think the Delta variant is coming. It will be the dominant variant in a reasonable length of time, but it's how quickly that actually happens. I think that we just have to try and delay the actual spread, and I agree with everything that's been said before, but I must compliment the actual public health services. They have been on this. Anytime there has been sequencing of people coming from abroad, there's 30% of all the cases that are done are actually sequenced. So when a Delta variant arrives, public health have been very active. So we're trying to slow it, and I must add the other factor is that people have been doing a really good job. I know you can say that they're out more, but people generally are following the rules, and that's the biggest break that we have. And I think going forward, the vaccination is important, public health is important, but I think the biggest break will be just in reminding people to keep doing the good work that they're actually doing, and that has been the biggest break. We've only recently come high up in the vaccination stakes, but prior to this, it was just good bloody work by the people.
And do you think, given what you've seen, that the vaccination programme and the work that people are doing with maintaining social distance, that will be enough to stay ahead of this variant, or are we going to land in trouble before too long?
I think those are the positive things. I think the work of the work of people, vaccination and public health are the positive issues. Naturally, as was mentioned previously by Aoife, we were doing very well, and then the only sort of risk on the agenda was the opening up issue, but the Delta variant has added a new risk to that. The other negative factor is the malware attack has really affected the numbers. It's only now that we're becoming aware of the actual presence of the variant. The actual numbers that NET had, that Public Health had, has been hampered by that. So I think it's very important in the next 2 to 3 weeks that people just become that they persist with the good work they're doing, but that they become logical, and let's look at the numbers. The good news is that the 14-day average has gone below 100. I think it's 99.9. That's good. All the positive things are fine, and the opening up and the variant are the only negative things. So let's look at the numbers and see what transpires.
Well, and where you are in Donegal, there, the northwest has been a focus in terms of the Delta variant. What are you seeing there, and is there a cross-border element to it?
Unfortunately, we're not. The problem is that with the malware attack, the funny thing has happened. People are just going directly to the COVID centres, which was essential at that time. But it is hampering our ability to visualise what is going on. We've had no positive tests coming into the practice because people are self-referring. They're getting their positivity. They're then waiting for people to call up. So it is a little bit of a hampering in our ability to actually visualise. The only good thing is that we have to, as it were, we have to order tests for young people. People above 16 can walk in, and so far we've seen an uptick in viral illness amongst young people. But so far we've had no positive COVID cases, never mind positive Delta variant cases. So that's good.
Well, you'll have heard Dr. Mary Favier and Aoife McLeod both saying that we may need to pause what we plan to do in July with the reopening of indoor drinking and dining, and also perhaps look at travel. Aoife said earlier. Do you agree that we might need to not go ahead with those plans?
I agree it's a big variable that we have to look at. I think I agree with everybody. It's a positive, it's a really positive image opening up and opening up the hospitality, the indoor hospitality, but it is a negative variable, and we have to be very careful. I agree with everybody that it is a controllable variable that we have to look at, and unfortunately the numbers, because we're getting sort of numbers very slowly, it's becoming quite difficult to sort of model. But I think in the next few weeks the modelling, if it's looking ominous, I think we have to be brave.
All right, thank you very much indeed. That's Dr. Dennis McCauley, and my thanks also to Professor Aoife McLeod and Dr. Mary Favier. Coming up next, congestion charges, anyone?
Text 51551. Today with Cabra on RTE Radio 1.
This is a message from the RNLI. We want you to have a safe and happy summer. So if you're heading to the coast, please respect the water and follow these tips. Choose a lifeguarded beach and only swim between the red and yellow flags. If you find yourself in trouble in the water, float to live. Lean back and use your arms and legs to help you float. In an emergency, dial 999 for the Coast Guard. For more safety advice, visit ornli.org/Beach Ireland.
Today with Claire Byrne on RTE Radio 1 with Opel, pure power, bold style, and unadulterated road presence. The all-new Opel Mokka. Today with Claire Byrne on RTE Radio 1.
That was a bit of a wake-up call there on the Delta variant. 51551 for your messages this morning. Now, London has one, so does Stockholm, as does Singapore and many other cities around the world. I'm talking about car congestion charges, and yesterday a conference in Trinity College Dublin discussed whether our capital city should be thinking along the same lines. In a minute we'll hear from Conor Faulkner, transport commentator and former director with the AA. But first, Professor Brian Caulfield from the School of Engineering in Trinity College Dublin says cars need to be treated like plastic bags with levies put on their use in Dublin, and he joins me now. Good morning to you.
Good morning, Claire.
Thank you very much for joining us. So when do you think that car congestion charges need to become a reality in Dublin City, firstly?
So in Dublin, I think after 2027, when the metro will have been delivered, as will Bus Connects, I think that's when we need to start to consider congestion charges. And I think now is the time to start the conversation about them. I think they're going to be inevitable in the city.
Okay, that's a big variable there, Bus Connects and the metro. If those things don't happen, should a congestion charge be in place?
No, I don't think. I think people need an alternative, and it's not just Bus Connects, it's not just the Metrolink. There are other projects that can deliver mobility for the city, but without those in place, I do think it would be unfair and inequitable to expect motorists to be charged. But with those projects in place and the amount of money that the state is spending on them, I think a congestion charge is inevitable.
Is there any other way to do it, to stop cars or discourage cars from coming in?
There are other ways to do it. So what Paris has done is that they've basically taken a lot of road space out of the city. They've also introduced a low emission zone, and so certain vehicles can't get in. Another way to look at it would be to look at parking within the city centre, within the canals, how much of it that we offer to motorists. Can we reduce that? And then that would then also result in a decrease in congestion.
Okay, so for the people then, thinking about who this is going to affect most, it'll be commuters, the people who bought the house in Kildare or Meath or further afield. They're the ones really that will suffer on the head of this, aren't they?
Potentially, yes, but there will be alternatives available. But when you look at the count over the canal in 2019, only 27% of the traffic over the canals was by a private car. So the numbers are dwindling in those that are driving to the city centre.
Okay, Conor Faulkner, as I said, is also with us. Conor, I know you've been asked about this in the past, but our commitments to reducing emissions now are very serious, very definite targets to be met. This is likely to happen, would you say?
Well, not for the reasons of emissions, unless that's used as some sort of a kind of a false flag for a tax. But broadly speaking, I agree with the point made in that we do have to provide public transport. And really, we could talk about all of the other solutions, Claire, imaginative ones and creative ones and bicycle lanes and this, that and the other. But we must provide mass public transport in Dublin. We haven't done it yet. We're 30 years talking about the need for metro in Dublin. We still haven't delivered it. And once you do have a quality public transport system to offer people, you suddenly find you don't need a congestion charge. You don't need to force people out of their cars when you've got alternatives. If you look at the Lewis, for example, the lines that do run, or the DART system in Dublin, they provide an excellent service, and nobody has to be persuaded to leave the car at home. The public transport options are packed. So really, this is it's a point that I've made over the years many times. But it remains a simple analysis. If you provide public transport and it's good, the citizens take to it in droves. They don't need to be forced. If you don't provide it, then no amount of forcing is going to help. So, for example, we could certainly keep traffic off the streets in Dublin tomorrow. We could achieve that with roadblocks, and that would be a traffic-free city. But it would cause enormous collateral damage. We need the city to function. There's more to it than stuffed olives and artisan coffee. It has to be a centre of industry and business, and that means a requirement for transport. And like it or not, in Dublin, the private car will, for the foreseeable future, be one significant component of that mix.
Okay, and Brian, what's the experience in other cities? So Conor is saying if you build it, they will come. There'll be no need for a congestion charge because people will use the public transport services that are in place. But London still needed to go ahead with their congestion charge despite having a very good public transport system.
They did, and the congestion charge there has reduced traffic on the order of about 15%. They've increased public transport usage. We see the same in Stockholm. The same thing happens there. But one argument I would give about the Lewis when it was built, a lot of people that use the Lewis basically transferred from bus to Lewis. So there wasn't as much decrease in car usage as we would have expected. So that's the kind of thing that I suppose I'm arguing for. When we put in all these public transport options, if the shift is just from a less efficient mode of public transport to the metro or the Lewis, then we're losing. We do need to get people out of their cars. That's the key target.
Okay, so you need to convert people. You're not taking people off the bus and putting them onto the Lewis. That's a completely pointless exercise. You want people to say, this is more attractive to me than using my car.
Exactly, and that's the key. And you said it earlier about emissions. We've 8.5 years to reduce our emissions in transport by 51%. The EPA today have already said that we're likely to miss our targets based upon our current plan. So we need to start to think big and imaginative, and this is one of the solutions, I think.
What would you do then, Brian, with all of the parking spaces that would be available and vacant in Dublin if this were all to happen?
There's a huge amount of space given up to parking in the city centre. I would suggest, you start to talk to architects and other engineers about what we could do with that
Charge me a moment, I got to have a Cabinteely first.
residential, recreational. There's lots of different uses that we could do for it. And I think I worked it out that it would be about 1,090 square metre apartments if the parking, the private car parks were transferred over to other uses.
Okay, and just to explain, where exactly would this congestion charge? Are you talking about inside the M50, or you mentioned the canals there? Explain to us where it would apply.
It would be within the canals, and that would be the most logical place to do it. So we've got a natural cordon around the city of the canals. We've also got loads of bridges over the canals into the city centre, and that's where I suppose you would place the cameras to capture people coming in and out of the city.
Okay, Conor, how does that suit you on the canals?
Well, no, it sounds horrific, I have to say. And again, it's a remedy worse than the disease, because, I mean, even in London, you had 87% of people using public transport before the congestion charge was introduced. And it was perfectly reasonable to regard residual car use as a taxable self-indulgence. But that's just not the situation in Dublin City. And again, clearly I no longer speak for the AA, but the points that have been made over the years by motorists remain entirely valid. People are crying out for some sort of alternative. Now, the biggest problem Lewis had pre-pandemic was that it was packed. You'd be more logic applying a congestion charge on the Lewis than on the roads. The capacity just simply isn't there. Dublin needs to build metro. Dublin has needed to build metro for at least 30 years. The best time to start doing it was probably in the 60s. The second best time is now. We need to build metro. And if we don't, talk about a system like Bus Connects, for me that just frustrates me. It's too small. It lacks vision. Dublin City's been here for 1,000 years. It's going to be here for another 1,000. It's going to need metro. And if you provide serious mass transit in that form, then if you have residual car use, you can look at it as a taxable self-indulgence. But between now and then, it is a fantasy to pretend that our congestion problems, let alone our emissions problems, are caused by motorists who won't do the right thing. It's a fundamentally flawed diagnosis. And I think, busier city than that with other people involved, it's just too simplistic and unlikely to work, I believe.
Brian, we have people texting us here who say that we need more of the carrot and not the stick, and the congestion charge is the stick. Certainly in the view of this person who says the easiest way to decongest traffic from the cities is to maximise remote working. People don't want to be in traffic jams in cities.
Yeah, I completely agree, and I think if you look at the data from 2019, people spent about 9 days in that year in peak morning congestion in their cars. We're not sure what remote working will do in terms of the demand for transport, and I completely agree with Conor. We do need the metro, we do need the big public transport projects. They're going to be very costly, but we need them to keep our city operating, and also to meet our emissions targets.
Mm-hmm. But what about this notion that what you're proposing, the congestion charge, it's the stick, isn't it?
It is the stick, but the stick would only come into place once the cars were there, and that is the metro, and that is Bus Connect, and that's how it's been done in many cities. And like we talk about London a lot, but Stockholm is another city, and it's pretty similar to Dublin. And what they did was initially they rolled out extra bus services, park and ride. They increased the capacity on their rail networks, and they did that over 6 months prior to introducing the congestion charge. And it was brought in there as a trial, and the people wanted to keep it, and it is quite successful.
Another listener suggests small electric motor vehicles are a solution to reducing transport on the roads, but towns and cities will need to be pedestrianised for that to happen. So once you get your public transport into the city, how do you then move around easily, Brian, in the city? Do you have a plan for that?
So within the city, there are lots of things that we can do. So if you look at Dublin, we've Dublin Bikes. It's been very successful. We look at scooters. I think they may take up some of that demand. Then also, I'm not saying that taxis shouldn't be in the city centre. Small electric taxis could move people around when they get into the city centre, catering for that last mile demand.
Mm-hmm. What about electric vehicles in general, Brian? Are you a fan?
I'm not really a fan. I do think that we will need electric vehicles to meet our emissions targets, but the amount of money that's been spent on them, I think it's maybe
by who? By the people who are buying them?
By the people that are buying them, but then also by the state. The state puts in about 13,000 per brand new electric vehicle that's purchased, and that's across the country. So there isn't a the Green Lewis line, I would get €13,000 for an electric car if I wanted to buy one. But say somebody living in rural Mayo, they won't get it. They would get the same grant as I would get. So do I need an electric car, or, for transitioning to low or zero emission transport, do people in rural Ireland, do they need a greater incentive?
Mm-hmm. Okay, Brian, thank you very much indeed for joining us. And Conor Falkland too. We'll leave the last word to this listener who says, I'm in my car now on my way to work. I could easily do that trip on a bus, but I'm too lazy. Increasing tax would make me change my habit. 51551.
Introducing the all-new Citroen C4, available in petrol, diesel and 100% electric. The C4 crossover features our very best in comfort, safety and technology as standard. Experience suspension with progressive hydraulic cushions and advanced comfort seats. You can also take comfort in a 5-year warranty and flexible payment options too. The new Citroen C4. Put some comfort in your life. See citroen.ie. Today with Claire Byrne on RTE Radio 1 with Opel. The all-new Opel Mokka. With a new visor front face and pure panel interior, this is Opel. Today with Claire Byrne on RTE Radio 1.
Recent figures published by the National Treatment Purchase Fund show that there are around 90,000 children currently on public waiting lists for treatment in Irish hospitals, and GPs, paediatricians and charities such as Inclusion Ireland are saying that they're deeply concerned about the effect these delays are having on vulnerable children. Evelyn O'Rourke has been talking to people across the medical community and the families to find out more, and Evelyn is here now. Good morning, Evelyn.
Good morning.
So remind us first of all the situation on public waiting lists for children.
Well, the National Treatment Purchase Fund, Claire, they publish monthly figures, and those most recent figures, which cover the period until May 13th, show that there are 82,264 children on the outpatient waiting list and 7,698 waiting for an inpatient or a day case procedure. That means as well that there's 37,000 children on the outpatient list who've been waiting 12 months or more to be seen. Now, figures also show, and I know there's a lot of figures here and we will kind of move on from that in a minute, but just to give you a sense of where we're coming from, they say there's another 5,000 children on other public waiting lists. But the Irish Hospital Consultants Association, the IHCA, say that there are a further 8,000 waiting scans that are not recorded in those figures, so they're putting the figure in excess of 100,000 children. However, we have to say, those figures may run up to the 13th of the month because, of course, the hospitals were unable to file data to the NTPF after that date due to the cyber attack.
You've been talking, Evelyn, to some of the people who are concerned about the waiting list, and the first person we're going to hear from is a paediatrician, and this paediatrician has a special interest in disability and rehabilitation.
That's right. Dr. Erwin Gill is based in CHI Temple Street Children's Hospital, and he says that he spends much of his time in appointments with families listening to their worries about the gaps in the services and supports for their children. And he says that the system for assessing children's needs in the first place, which is where all this starts off, is technical and can be inconsistent, and we will talk about that assessment of need again at another time. But in short, once children get assessed, they're then entitled to different services, but there can be delays. And he says he's seen the impacts that delays are having on his patients, and that we need to commit to resource in our hospitals, filling in consultant and therapist gaps. He says that his patients, he has patients whose development is hampered by the delays, but he's also full of praise for his colleagues and the hospital teams, but he is frustrated at the system, he says, not the people as such, that leads to these delays, saying some patients are waiting years, and he thinks we've accepted these delays as normal. So here Dr. Gill tells me a little bit more about the experiences and the stories he hears in his clinic.
What I see in my clinic on a weekly basis, we meet families who tell us that when they've gotten through the assessment process, which can often take an extremely long time, what they're told is that in terms of the waiting time to actually get help, therapy for their children. In North Dublin, I've had children in my clinic the last few weeks who've been told they must wait over 3 years for that kind of intervention. So to put that in context, that means that a child who is referred at the age of 2 won't get any help whatsoever from disability services until they're in school, which is essentially as good as no service at all. And to put this in context, in other countries in which I've worked, in the UK and in Australia, it wouldn't be unusual to expect a child to be enrolled in early intervention perhaps within 3 or 4 months of having been referred, whereas here it's 3 or 4 years. So I think a lot of this has become very normalised. We've gotten very used to children with disabilities having to wait for everything, and I think people have lost sight of the fact that this is not the way that most countries do it. It's not normal at all, nor is it acceptable, and I think it reflects a level of comfort with it that we shouldn't have. We've gotten very, very focused in this country on the headline issue of assessment times being the thing that's the most important, and we've we've lost track of the fact that the intervention with therapy teams is what actually makes a meaningful difference. And the families who I see here in clinics who are waiting for years with no help whatsoever are often distraught. I can see that children don't get those early years back. We have a meaningful window in the early years with children to intervene and to get them in with expert therapy. Criticisms of waiting times, from my perspective, is not criticisms of the people who are actually providing the therapy. It's criticism of the system.
In terms of you working with your colleagues, it must be deeply frustrating then.
We do what we can. Part of the work obviously is advocating, so we will write our letters to say this patient has been, they're back to see me again for the second time in 6 months or 9 months or a year or however long it's been. Ultimately, there's only so much therapy time or so much intervention time to go around, and we write these letters because we feel we have to do something. But ultimately speaking, if the system isn't resourced to provide timely intervention, it doesn't matter what letters we write. It's the truth of it that the system is not set up for success. That can be incredibly frustrating. It certainly can, yeah.
That's Dr. Irwin Gill there, a paediatrician from CHI Temple Street Children's Hospital. Now, some GPs have been vocal about their concerns with the delays, Evelyn, and you spoke to the Deep End group of GPs, and they're speaking out about this. Will you tell us more about the Deep End group?
Yeah, it's a great name, isn't it? GPs at the Deep End is a group of general practitioners, and they are working in some of the most disadvantaged communities in Ireland, and they say that when it comes to matters like delays and waiting lists, their patients are much more badly affected than patients who can access private supports, for example. Now, Professor Susan Smith is a GP in Inchicore in Dublin 8, but she's also Professor of General Practice in the RCSI, the Royal College of Surgeons. And here Professor Smith outlines the concerns of Deep End for vulnerable paediatric patients.
Deep End is a group of GPs working in disadvantaged communities, and the first Deep End group started in Scotland, in Glasgow, and we heard about them. We were already kind of networking informally as GPs working in those areas, and then we formed a group called Deep End Ireland. So we're linked to lots of other Deep End groups internationally, and our main aim is to try and advocate, to try and ensure that services are based on need rather than on your ability to shout loudest or pay.
But at this point then, what are you looking for? What is the clear advocacy line from Deep End in terms of this issue?
So we've been really concerned about waiting lists for services for disability and for mental health for children, and we work as GPs in disadvantaged areas, and it really affects those communities much more. That's for two reasons. Firstly, children are more likely to have needs in those communities, and secondly, there isn't really the escape valve of private services. So, for example, in one of the more affluent community health organisations in Ireland, there's about 370 children on a waiting list for speech and language therapy, and then in the more disadvantaged community health organisation, it's 2,800. So there's an 8-fold difference in the number of children waiting. The other thing that's been happening has been a huge focus on assessment, and that's welcome, but the difficulty is that it's all about assessment now, and really assessment without intervention has very little meaning for a child, and we are really advocating for major reform. There's a new system called Progressing Disabilities, which is seeking to address the challenges around assessment of need and the long waiting times for it, and in doing that, imbalancing the system further towards assessment and away from intervention. From a GP perspective, we feel we should be more involved in planning. Everybody says go to your GP when you have any problem, and yet we're not brought in enough in terms of planning services. And we are the first port of call for many of these families, and we know it's happening, so we should plan to do something about it.
So we're getting the message really clearly there, Evelyn, that assessment is one thing, but actually getting the services that you need is a completely different ballgame, and that's where the problem seems to lie from both those speakers, and that was Professor Susan Smith. Now, you've also been hearing from organisations working with families to offer support. So